Hello, everyone, and welcome to Lessons from the Trenches, our founders panel. This is the first live founder panel that we are doing on the Gerontechnologist, and I'm super excited to have three wonderful panelists with us today. We'll also have time for questions at the end, so feel free to just put in your questions in the Q&A box. I think we can just get started with introductions. So first things first, we've got Jennifer Cain Birkmose, who is a 24/7-year veteran in global healthcare with both World Health Organization and pharmaceutical experience. She's the co-founder and chief executive of Vivavalet, which is a digital elder care platform that provides services to support older adults to live at home independently. We've also got Anne Booth, who spent 30 years in the semiconductor industry before founding Unaliwear. She has sold two companies to Texas Instruments and Apple, and actually came back from retirement to start Unaliwear in 2013, inspired by her mother, who rejected traditional medical alert systems. And so Anne went on to build a smartwatch that is tailored for older adults, named the Cain watch. And last but not least, we've got Costin Tuculescu, CEO and founder of Onscreen. Costin also has plenty of experience, around 20 years of experience in tech. He also exited the company prior to Onscreen. Costin, Anne, and Jennifer, welcome to the panel. Thank you so much for joining me today from different time zones all around the world. I know some of you are currently in conferences, so thank you so much for taking time off your busy schedule to join me today. I want to start with the first question, which is, what was the first moment when you realized that this was not just a problem that needed solving, but that you were the person to do this? Anne, could you maybe take this one?
Sure. Happy to. So as you said, I was actually retired. I was working as a dive master on a liveaboard scuba diving boat. And then my mom turned 80, and my mom was a model. I'm the spitting image of my dad's sister, lucky me. And so, we had that conversation about the products on the market. She said, absolutely no way am I wearing a garage door opener around my neck. And I said, okay, Mom, I get that. As I was talking to, friends like you do, what do you do? What's going to happen? And when we came up with our battery system in the band, that means that you never take the watch off to charge. So it's there to help you with falls in the bathroom at night. That ability to be 24/7 is something that still nobody else has today. And that was the point at which I said, okay, this is worth doing. And I looked really hard to find somebody to do it for me so I could stay a dive master on a liveaboard dive boat, but I couldn't find anybody. So here we are.
Thank you so much for sharing your story, Anne. Costin, would you like to take it next?
Sure. So, yeah, I've been doing video conferencing for like 25 years. It was my first job out of college in 1999. And I've always loved communication and especially visual communication. And during COVID, I wanted to tinker around with the idea of video calls on the TV. Because it's like I grew up with the Jetsons, that was a certain vision of the future. Star Trek was a vision of the future where you had, Captain Picard talking to the Klingons via this giant screen on the bridge. And he would say on screen. And by the way, that's where the name of the company came from. And I wanted to really create a life-size experience for video communication using like my 60, 70, 80-inch TV. And Facebook had a product on the market called the Facebook Portal. And I was like, no one's going to want a Facebook camera in their living room. And so I tinkered around with some friends and we built this like really janky solution. It was like an Android box with a webcam that you plugged in. And we just put that thing on Amazon and people started buying it. But we weren't seeing as much usage and activity as we had hoped. But we started getting these frantic calls from folks, and they were like, "Hey, we bought your on-screen box, but my mom can't figure out how to use it. She's got early stage dementia. She doesn't have a cell phone. She struggles enough with her remote. And you've got this crazy thing. I'm calling her, and you expect her to answer on her mobile device so that the call goes on the TV. What are you thinking?" And so we really engaged with these customers that had a huge problem. They had the biggest problem that they couldn't see their parents in any other way. Their parents were in assisted living, they were maybe in memory care. And I was like, what is dementia exactly? Like, I've kind of heard about it, but I don't know much about it. Um, and so I really sort of fell in love with that problem of helping these folks get connected and bridge the isolation and the loneliness in a way that was life size. And I felt like with my background in video communication and my passion for using big screens to communicate, I was like, this is for me. We're going to work on this. And then on-screen just evolved from there into all the different tools that we do, all the other ways we support older adults now. So that's my story.
Thank you, Costin. Jennifer, I would love to hear your take on this.
Yeah. So thanks, Keren, and thanks again for the invitation to be here today. So why did I know I wanted to do this, and why did I know that I was the right person to do this thing? My co-founder and I, my founder and I, got together 4 years ago, and we were talking about being far away from our aging relatives. When I say far, we're living in different countries. And that means that if mom, dad, grandma, aunties, anyone that we were caring for, wishing to care for, became suddenly ill and needed additional assistance, we would have to get on a plane, disrupt our lives, leave our children behind, and go to a place maybe that we weren't even familiar with and try to figure out what is it that we need, who do we ask, where do we find it, and who are we trusting in this environment if we don't know it especially. And we realized that as we talked about this idea and kicked it around, there were so many other women who are this, midlife, menopausal, sandwich generation, going through the exact same experience or the exact same fear that they were going to have to deal with that. And of course, in the middle of all this, I have had to deal with that myself, where I have had to uproot myself and fly thousands of miles to visit my aging relatives. And so in that problem, we looked at, well, okay, if we're not there to solve these problems and to support the living that would be at home independently with confidence, who can we rely on? So yes, there's healthcare services that can be provided, but there's all these other things that are a part of enabling people to live at home, which aren't necessarily healthcare. So that's what we realized. How can we create a kind of digital platform? So Costin, you were talking about how do we work with tech? And I know that Jean-Anne, you also said that tech is a challenge with your mother when she was turning 80 and needing some support. We saw the same thing. And so we became very passionate about the tech journey of how do we create digital solutions that could enable access to physical services so that olders can live at home independently. So we got really excited about this issue and we started designing with olders. So it wasn't only that we were designing for them and saying, we like this idea, therefore we're going to make this app or we're going to make this service. We actually did ethnography and we worked with them with olders in 5 different cities. And in fact, 2 different countries. We also paired this in India as well, to understand what are the hopes, dreams, and fears of olders for living at home independently. We already knew what we as adult children, what our hopes, dreams, and fears were around serving them. And we created a solution where olders and their adult children can access services at a phone call or locally, if you're based out of Chicago, Illinois, to get things like food delivery, rides, tech services, tech coaching, home safety assessments, home modification. So it was really just this love letter to the people who are living through our experience and getting really passionate about the problems that we all had in common. Thanks, Keren.
Thank you so much, Jennifer. This actually leads me to my next question about what did the early user discovery process look like and what would you have done differently in hindsight? I'd love to get anyone's answer on this, whoever wants to answer.
So actually, I want to talk about this because really, honestly, Unaliwear is, my mom's gift to the world. She was our senior user experience advisor, which was our joke, right? She was our senior user experience advisor, and she also was the senior user experience advisor. Nothing went through without her approval. And during our design phase, we did focus groups with over 400 people all across the US between the ages of 70 and 90. So we learned an absolute ton. And you know, your question was, what would you do differently? And the answer is, I wouldn't do anything differently, because the thing that you learn is nothing about me without me. Right? So you have no idea, even if you think you're really good at putting yourself in the shoes of a future you, you're really not. You actually have to hear from the people who are living daily with the challenges that they live with and the ones that you're wanting to support.
Keren, if I can jump in as well. So, Jean-Anne, I love hearing your experience, and it's very similar to what we did ourselves, and also the kind of ethos and philosophy and kind of North Star that we had as well is that never make a decision about them without them. As tempting as it was to say, well, we know a problem. We've seen it. We're living it. We're the youngers. I've never been 80. I've never been 90. And so we had to take the time and do the research. And I'm so glad that we did, to do the ethnography. Again, cameras in people's homes, doing ethnographic research, really understanding before we designed any type of service or any code at all, to say, what are your goals? And what are your goals for life? What are the challenges that you have on a daily basis that you're trying to solve for? How might technology help you? How might it not help you? And what are the things that are even non-tech that you would like to get support with? And so we were able to do that. And again, like you, Jean-Anne, I love that you say this, that 70 to 93, I think, was our original group. And those people also, we retained to do not only the qualitative interviews, but also the quantitative interviews, focus groups, and they always did our beta testing as well. So we don't know what that's like to be this age. And so as long as we're keeping the design focus fully focused with builders, I found that it's been a better solution. So given that we had this ambition to have this tech platform where people could easily access things, we went forward with that. The thing I wish we would have done is that I wish we would have actually understood the core aspect of the ethnography was it's all about trust. So anything that we were going to do for elders in their homes, for them, with them, required trust. And without that, we weren't able to have our business at all, which is fine. And that's actually how we built it with them. I wish we would have spent more time doing ground events, because we thought, since we're doing tech, we could probably do tech acquisition through different channels like the Googles, the Facebooks, et cetera. And although we can and we do, we are much more effective when we're doing ground events, face-to-face events, really showing our potential customers who we are, demonstrating the product, letting them play with it, but most importantly, building those relationships and community. And I wish that we would have taken our digital budget for the first year, and I wish we would have taken all of that and only had ground events, because the more we do there, the more I realize we acquire customers that stay longer. We also acquire customers who refer us more quickly. And that's just maybe the mistake. If I could travel through time, I would have done that differently.
Thank you,
And I'll
Jennifer.
chime in
That's
with a
fascinating.
quick one additional sort of point. We found that our customer, the buyer, was actually the adult child, and they had strong opinions about how the product needed to work. They were the most vocal one that engaged with us. And in fact, if you're dealing with this sort of pair, right? You have the caregiver, care receiver. I don't know what terminology other people use. That's where we landed at Onscreen. We didn't hear as much from the care receiver because they have maybe mild cognitive impairment or they have early stage dementia. Also, their children are very protective of them. They're like, no, you can't talk to my mom. I'll talk to my mom. I'll figure out what mom needs. And then I'll tell you what we need together. So we found that talking to the buyer was extremely helpful, and literally we'd get some calls. We'd double down on, okay, do you have more time to tell us about this pain? Explain this pain point to us, because we were so new to this concept of these pairs. And then we would build something, and then we would set up another call with them 2-3 weeks later and ask them, how did that go? Do you like that new feature? Did it meet your needs? So it was this discovery process, very iterative, of working alongside that family caregiver, which is a real interesting aspect of working in AgeTech. And Keren, I should have better insight about the questions you're going to ask us, because you sent us that list, but I don't know if we're going to talk a bit more about the caregiver, care receiver dynamic, because I think that's really nuanced, and founders should know about that when they get into AgeTech.
Absolutely. I definitely want to dive deeper into that, because I think that is one of the things that makes building in AgeTech more challenging than building in other ecosystem. And I wonder, what have you all been doing to sort of meet the needs of both of these very different stakeholders that might have a different vision of what the outcomes should be?
So let me piggyback on where I was with that. And it's not even just family caregiver, older adult. It's that payer, that sort of stakeholder of the older adult might be a healthcare provider, an insurance plan, healthcare plan, a Medicare Advantage plan. It might be a senior living executive. So not only do you have to design a product that meets the needs of the older adult and solves a problem for them, but you also at the same time have to solve a different problem for many, many times. I would say in our case, over 90% of the time, somebody else is paying for the service. So you have to solve that person's problem, almost more importantly, otherwise you don't get in the door. And every one of those stakeholders, like family caregiver, senior living, health plans, healthcare providers, maybe AAAs, all have completely different metrics, different measures of success. And just as a founder, my head is often spinning. Who am I building for? How do I create success by making them successful? Who's them? Is it the older adult? Is it these stakeholders? I'd love to hear some of the other founders' thoughts, and maybe even in the chat, folks can put in, like, how do they prioritize who the exact customer is?
I think, when you look at that question, one of the things that you have to recognize is that the demographics are changing. So in the old days, everybody knew that the buyer was the alpha female, right? The chief health officer, that woman between the ages of 40 and 60, buying for the parents and for the in-laws. The thing that not everybody realized is now that the baby boomers are getting into the olders category, 2/3 of the younger baby boomers don't have children. So in the United States, 16 million people are already elder orphans, which goes back to your point of you may be actually trying to satisfy not the alpha female, but satisfying a provider, a payer, a care system of some sort. And honestly, I think that's one of the places where we get challenged in this industry is that the stakeholders are very broad, and some of them are governmental and some of them are very personal. And so what we do is we really focus on we say the wearer, right? The person who's wearing a Kanega watch, because in the end, that's who we serve. We do what's necessary for the payer, whoever that might be, but our mind and our focus is on the wearer. That's the person we love.
Oh, I love that. So thank you, Jean Ann, and thank you, Costin. So I hear all of you, and I'm also torn in that pendulum often between end user who receives the service and those who pay. We have made the distinct decision to go self-pay, and it might be controversial. There are others in the space who are doing great work that do something slightly different from us. For example, I think of Pop-Up Pals, who are working through Medicare Advantage. even in discussions with some of those founders where we're in touch and seeing where do we co-promote, for example, they all, because they have a different payer than we do, our payer is either the end user themselves. So you better be sure that everything we're doing is making it is simple, straightforward, trustworthy, and reverent, really, truly, like with respect of the older themselves. Versus having to have a data strategy for a third-party payer like an insurance and Medicare Advantage or et cetera. So because once you have that third-party insurance payer, you're going to have a different requirement. So for those of you who are watching beyond our digital table, you're thinking about maybe a medical device, which could be a piece of software, which could be like the watch, for example, that Jean-Anne has. If you're going to go that insurance route, you need to understand from right now, the moment of design, what is going to be your data strategy? What are going to be the endpoints that you're measuring for? So, for example, is it days without a fall, or is it going to be days reduction of hospital stay, or reduction in higher levels of care referral, those kinds of things? That's what you're going to have to measure if you want to have a payer who is a third-party payer like insurance, Medicare, et cetera, cover that for you. We actually decided not to do that because we want to focus entirely on the interests and the needs of our olders. And we know that. I love what you talked about, Costin, because this idea of scope creep, when you get more stakeholders in the buying process, they want to add more features. And having come from pharma myself, I've seen where we've created digital biomarkers, for example, for multiple sclerosis, where the clinicians keep asking for more, or maybe industry keeps asking for more and more endpoints. In the end, it becomes too complex for the end user, i.e. the patient. And if it's not easy to use for the patient, it won't be used at all. So that's the philosophy that we keep running with our own software.
That is wonderful. And does anyone have anything else to add on this?
I was going to add that the reason I think a lot of startups get pulled into these multi-stakeholder situations, especially trying to go B2B, because we've always had the same North Star. The North Star is the older adult has to have a great experience with the product, and so does the people calling them or their immediate caregiver, because in our product, there's always kind of a two-person setup. But investors, and maybe Keren, this is where it's a tie into the next topic. They're always selling individual units is just not fast enough, not scalable enough. What's your go-to-market strategy where you're going to be able to sell 100, 1,000, 10,000 at a time and be efficient instead of paying, $150, $200 CAC per sale? And I'm sure other founders out there are dealing with this exact issue of, I'm really focused on the problem, but investors are telling me, what's my B2B strategy? How do I scale this thing? And now you've got more stakeholders in the conversation. So that's something folks have to really watch out for.
And it's actually even more challenging than that. I mean, we're direct to consumer, which was not actually my original plan. But the thing you have to understand is oftentimes with the B2B connection in silver tech, it's actually not aligned incentives, right? So Jennifer talked a little bit about this, what are you going to do? Are you going to be fall prevention, fall detection, whatever? And the thing that people tend not to realize in the United States, right? We have this perspective that says that the government is responsible for old people. And therefore, that means if Medicare doesn't cover it, it must not be necessary. But of course, what's the number one cause of injury death? Falls. So it must actually be necessary, just that the industry hasn't done the work to make sure that CMS actually handles the tools that will actually prolong people's lives. But if I can say this in a, super blunt way, the incentives are misaligned, right? To Medicare, if you fall, break your hip, and lay on the floor and pass away, that's actually a better outcome from their perspective because they're not paying for you anymore. Now, on the human side, that's the worst of all outcomes, right? But the incentives are misaligned. And that's that B2B direct-to-consumer private pay challenge that we all have to deal with. And so, when you're looking at trying to get funding, finding a way to stay true to your vision with the funding partners that you're trying to work with is critically important to being able to actually deliver the reason you got into this business in the first place.
May I jump in? I don't know if we're already switching to looking at the funding cycle. And Jean-Anne, I really want to jump into what you just said because, for those of us around our digital table, and again, those of you who are listening, if you're starting something yourself, often the question is, when do I start to fundraise? And I think if there were, again, in the bucket of wish I could have done this differently, going back in time, I wish we would have started to fundraise earlier. We self-funded, bootstrapped, got angel investing early on, and we're now doing full raises right now as effectively seed extensions. And the hunt of an aligned investor with us who is values aligned and also capability aligned is so vital. So it wasn't our hesitancy to seek external financing was less about surrendering equity. It was more about around what Jean-Anne is talking about, because it's so easy. And I've talked to other founders like ourselves who brought in big money, really like successful, getting Sequoia in, bringing in the millions, tens of 50s of millions. And what happened was, of course, those private equity folks ended up on their board and they started to steer the direction of the business. And I know that we were desperately afraid of that because we wanted to find, like Jean-Anne's talking about, investors that were aligned with our values and continue to have full reverence to olders and would continue to be designing specifically for the end user, not just for the others who are going to be in the buying cycle, and also had that same capability that we were looking to fill in. So for us, for example, last mile competency, last mile delivery, logistics, really a key area for us to find investors who understand that.
And I'll add one other thing. So for my semiconductor companies, I raised over $100 million in venture capital. Okay, physical product companies, big money, big stuff. And so one thing that I didn't do when I started Unaliwear, I'm looking at a marketplace that today over 70 million just in the United States, a couple of billion worldwide over the age of 65. And I'm like, of course there are growth VC funders. And so I'm not going to identify them ahead of time, which I would do in my semiconductor companies. I'm not going to identify them ahead of time because there's going to be plenty of them. And what I discovered is, not so much. And so, we don't fundraise anymore. Thank you. But when we were fundraising, it was really quite the interesting challenge because, finding entities that wanted to fund a physical product in silver tech is really, really difficult. And so we ended up raising $22 million from angels. And now people are really funny. They're like, well, you don't know how to raise from a VC. And I'm like, oh, yeah, that 100 million. But it never occurred to me. And honestly, I'll tell you this. If you are thinking about starting a silver tech company, the only reason that Unaliwear is still here, the only reason that for 3 years in a row, New York Times Wirecutter has named the Kenen watch the best wearable medical alert in the United States is because we were funded by angels. No VC would have had the patience for us to develop a brand new category-breaking product like the Kenen watch. Only the angels had the vision, the strategy, and, frankly, angel grit, the tenacity to get there with us. So I'm a big fan. I've got awesome angels.
So let's talk about that because the very first thing I tried to do was go to my angel network that I had previously raised money from. And one of my struggles was a lot of these angels are older. And I'm telling them, guys, there's 6 million people with dementia. They 1 out of 3 are lonely. And, we're creating this solution that's going to help older adults stay connected in their late 70s, 80s, 90s. And I was doing this, of course, on a Zoom, and they're in their mid 70s, and they just came back from the tennis court or pickleball court, and they're like, "What are you talking about, Costin? Like that just look at me. I'm a 75-year-old. I'm on Zoom. I have no idea." So my pitch, and that's probably Costin's fault, no one else's fault, it just didn't land with angels. And then the younger angels, you know, also didn't resonate. So there was something about my pitch around loneliness and isolation. Maybe it didn't have enough teeth. Um, and and then it was always kind of like, okay, come back when you've gotten more traction. Come back when you've got more revenue, etc. So goalposts keep moving. Jennifer, would love to hear kind of how you're going about fundraising.
Yeah. So, sure. Happy to talk about it. And also, if I may hitch on to what you were just talking about around loneliness, because we're talking about sort of the value proposition of the values that we have and the value proposition of the data that we can generate in all the businesses that we have. So we know that we have voice recognition data that we can now share, that we can use, that's part of the calls that we have with olders themselves. I know Jean Ann, you're data rich as well. I think this idea of monetizing a solution for loneliness, Costin, is really important, and putting that in your pitch. And that I was inspired.
Just from experience, it doesn't land.
So
I'll be very
Yeah.
Controversial and
Oh,
blunt.
I'll add 2 points. And one is that one of my inspirations was working with Discovery Healthcare in South Africa, who did something similar to what we do, because we do wellness checks where we call our customers once a week. And it's really nothing about the business. It's just to say, how are you? You doing okay? Just checking in on you. And I worked in a different life in pharma with Discovery Health in South Africa, and they started to do this with their chronic illness patients with a monthly check-in. And what they found is that those patients lowered their premiums or their health costs inside their insurance system by 40%. That's massive. And so having had talks also with Papa, and if you look at, even if it's not your own, you could use that data from Papa as a proxy, because they've got documentation that's pharmaceutical grade reductions in hospitalization, going to higher levels of care, seeing the emergency room, fall prevention, through the kind of solution of loneliness, of delaying loneliness and having a solution for loneliness. So I invite you to look at that, because they're very data rich and they're very publication rich on that as well.
So just for the sake of making sure the founders hear it from all angles, that's a positive angle on using loneliness and isolation as a way to monetize your AgeTech startup.
Yeah.
On the other side, I've heard it directly from a very large health plan provider that they could not connect the dots between solving loneliness and isolation and having that intervention prove ROI for them. So it's not a strong enough driver of action and purchase for them. So
here's the reason why. It's because in the United States, the money doesn't follow the person, right? So when United Healthcare spends $1,000 solving isolation and loneliness for me, and then I go and change to Aetna, United Healthcare just lost $1,000, right? Because that benefit that they paid for, United Healthcare paid for, Aetna gets the benefit of it, but they didn't pay for it, right? And so
does that happen a lot? Do people change their healthcare provider often?
Oh, you betcha.
Yeah.
Especially in Medicare and Medicare Advantage plans. You betcha.
Turning once a year, yeah.
Yeah. So that's one of them. And also the other thing, there's a question in the chat about nobody's saying the word senior. Are you guys avoiding saying senior? And actually, for us, our proposition is independent but vulnerable populations. So our youngest wearer right now is 35. Our oldest is 104 and a half. Okay. And she is a rock star. She posts on Facebook and the whole 9 yards. So, I'm just saying, it's not about age, it's about where you are in the spectrum of the continuum of aging. So, the only time I ever talk about age is when I'm doing the demographics of the aging population, because that's the only thing that's direct. But the social determinants of health, which is the richer you are, the longer you're healthy, says that, for a Kanega watch, then you're going to have a population that is going to be older because we're not a cheap product. And so our average age of our average wearer is like 80. So
Yeah. But just to put a point on loneliness and isolation, it sounded like what you brought up, Jean-Anne, the fact that United Health won't get the benefit of investing in loneliness and isolation is yet another point that it's hard to monetize a value proposition of reducing loneliness and isolation. So I just want to caution the startups out there. It's a great value proposition to put out there, but make sure you've got others as well. Because I've seen folks talking about it, but very few folks acting and deploying dollars towards it.
And where I see that working really well is with Papa, because again, in discussions with their founders, they had that as a strategy from the beginning because they knew that they wanted their payer to be Medicare Advantage. So in order to do that, they had to set up the data infrastructure to understand that vertically integrated prospective data collection aspect, like from real world evidence, that for every utilization that they had of the product, they could connect that back to claims data in the insurer, who's their payer. And they could say, oh, well, interesting. For every month you have a support service from Papa Pals, for example, you are seeing less healthcare you're utilizing fewer healthcare resources. So they've made that straight line. And one could say, if you see a reduction of hospitalization by 30%, that's a pharmaceutical grade intervention. So I'm with you.
That may not be a pure loneliness and isolation. Those Papa Pals go into the home. They help with ADLs as well.
Yeah.
So you got to be real clear. Like, I know that there's things that are just virtual, digital interventions that are purely for loneliness and isolation, which may not be as effective as a person coming into your home, right? So we solve loneliness and isolation is a bit of a dangerous path for a founder, even though it is so loud. Everybody talks about loneliness and isolation. It's such a giant problem. Everybody should solve loneliness and isolation. But just saying that you do is not necessarily enough.
And if you do, just make sure you have a data infrastructure around it. I wanted to, Jean-Anne, you mentioned this comment that I saw in the questions as well about an allergy to using the term senior. I think that's really entertaining. So whoever wrote that, thank you for the laugh. And I will explain why I say older is that when we did our ethnography, we said, we want to build a business that's around respecting your life experience, to revere you for the life levels you've lived, not to call you old. What do we call you? And some of the people were hilarious. Some of the things that they said, well, we're not old, we're not dead yet, just say that. Of course, we're not going to call our customers that, but we asked them, like, is it senior? Is it elder? Is it... And there was an allergy to all of those terms because they seem to be somehow either overused or they're not with respect. They appreciated to be called older because they said, we know we are. It's all of us who are in our middle-aged years who are worried about older.
I'm
right?
older.
You're older.
I'm also older.
I am
than
my
Mike.
demographic. Thank you very much.
Okay. But they asked us, said, call us older. We like it. And we find it more respectful. So that's how we came up with that.
How big was that survey? What was the sample size?
So 15 in 5 different cities. And then we replicated it with 200 in India as well.
Okay.
In Mumbai.
And I've
15.
seen surveys that specifically survey the 60 plus or 65 plus population. And most people prefer to be called older adult rather than senior or senior citizen.
It's so interesting. This whole thing has been a nightmare, to be honest, because I don't know how big these surveys are. I think it was maybe AARP that came out with older adults in that survey that you were quoting, Keren. I don't know the sample size of that either. And I don't
Competitive, if it's an AARP survey, it's a huge sample.
It might be 1,000, right?
No,
but
no,
it's
no.
1,000 out of 60 million.
Bigger. I mean, because we
2,000.
also took that on the road, and we had, I think, 30,000 to verify that from a quant perspective, and we had the same feedback coming
My
back.
point is, when we've created literature, blog posts, we've talked to the family caregivers, there's no aversion to one term or another. And in fact, like the language of the customer, the family caregiver, they might prefer senior. It's way less of a mouthful than older adults. Like it's just such a mouthful to say older adults. And then the term olders, this is kind of like the first time I've heard it more than a few times, and say, oh, when the olders are walking into, like, what does that even mean? Right. So it is such a tough thing that we don't even have a widely accepted nomenclature that an entire market can just be like, yep, that's the term.
Well, but I mean, look. So the other side of that is there are a lot of cultural and personal aspects that are a part of the aging process that we're doing a better job now of understanding, but certainly for a long time nobody did. So for example, if you said senior, that meant you were going to be wearing a garage door opener around your neck, and that would be the outward sign to everybody that says I'm old and I'm not in control of my own life, right? And so that's where a big part of that aversion comes from, because even for anybody, when you look in the mirror, you see a younger you, right? So I'm 63. So when I look in the mirror, I see 40-year-old me, not 63-year-old me, right? So that's a normal part of the human experience. So when you say you're old, then what you're inviting is that internal that doesn't mesh with the 40-year-old me I see in the mirror, right? And that's where that a big part of the pushback comes from, and it's also where the pushback comes from when you talk about the alpha female being the buyer. I know what's best for mom. I'm going to tell her what to do. Now, if mom still has capability, mom's going over my dead body, right? So that and that is actually a big part of the tension of the market and who you're selling to in the marketplace, right? Because if you don't acknowledge the challenges of aging in a respectful way, I can't see, I can't hear, I can't touch, but other than that, I am just like a 40-year-old, right? If you can't acknowledge that, then you aren't going to get the wearers to be wearers, or in your case, Costin, the users, right?
Yeah, I have this pet peeve around all the different terminology, and it would be nice if it was a simple word that people can say quickly and everybody agrees that that's the right word.
For sure. So the next topic that I wanted to cover is, again, ties back to the user research and listening to both the customers and the buyers. Was there anything that your users or customers told you that completely changed your roadmap or strategy?
Yeah, I definitely had one. So when we were running all those focus groups, the first thought I had, remember, mom was a model. She's gone now, but she was a model. She was drop dead gorgeous, and I clearly am an engineer, and so I wanted to stay away from anything that had any aspect of style whatsoever. Because no. And we went into focus groups with something kind of like a Fitbit Flex, if you remember that, the first generation, Fitbit tracker that was kind of flexible, little band. It was so cute. Oh my God, they just trashed it. And they're like, if you're going to give me the time, give me a watch. And I'm like, okay, that's what we did. And so in a nod to style, it comes in 3 colors: rose gold, champagne gold, and gunmetal gray, also known as black. So, it's just super challenging, but I never expected that. I really thought they were going to be, this is my favorite watch. My granddad gave it to me. Yeah, I've been wearing it all my life, but that was not the case.
For us, for sure, it's trust. We will not work with you unless we can understand, unless we can get to know you. So the personal relationship was really interesting, and important. And having time to invest in that personal relationship was the way we're going to demonstrate trustworthiness, and also all the other things that we do in the background, like the background checks, the criminal background checks, the training that we do. We have the eyeballs on our service providers when they go to the houses, when they check in, when they check out. We have all these extra metrics that demonstrate and show our work that we are really looking after the safety and trust of our olders. So that was maybe not a surprise, but to the extent of which we had to go to demonstrate that was perhaps a surprise. The other thing, two other things. One is really the confidence. Whatever you can do to, I wouldn't say build, but protect confidence. So we're in a world where everything is changing around our olders, especially when we talk about the world of tech. For us who are maybe more tech savvy and more tech native, it's easy for us to keep up with it, but it's less easy for an older to accept a change in any type of tech interface, whatever. So making sure that it was always simple, consistent. And I think the last one would be eliminate some choices. So this comes back to do one thing really well. And that there's so much decision fatigue for olders. And so even when we looked at the UI UX, when we would work with our olders to design, how do you create an order flow that looks really simple and easy for them that they prefer, with colors that would still be vivid because they're losing color acuity as they age? It was eliminate extra choices and just to say, okay, based on what you need, we're delivering this option to you. Instead of, hey, based on what you need, we've got 5 options, choose one. That actually was an exhausting step for them. So eliminating choice, doing one thing really, really well, and being simple.
Costin, do you have anything?
Nothing immediately jumps to mind, but we are actively in that process as we're like launching and deploying Joy Calls. And this is a brand new service that is an AI companion that calls older adults on the telephone. And we are learning left and right around what exact terminology we want to use, what exact problem we're solving. We are back to square one with that sort of discovery and getting surprised. One of the things that has stood out recently is how many folks are like, no, I don't think my mom would ever want an AI to call her and chat with her. And this was before we've been trying to commercialize it. It's just been like a free service, right? And we're like, how about we just try? Let's try. And give us some of your mom's interests, and we'll load them up so that Joy knows about these things, and Joy will bring them up. And then you see the shock on the children's like face when mom actually did enjoy her conversation yesterday, and now she's looking forward to it today. And so I think we're in such an innovation cycle right now with AI and what can be done that there's gonna be a whole lot of these shocks and surprises for people, like what works with AI, what doesn't work at all with AI. How should you position your marketing and your language? Like, oh, mom, I got this product because I don't have time to call you. No, you don't want to say it like that. So yeah, we're in it, we're living it, and maybe we'll report back in 3 to 6 months, Keren.
I look forward to it.
So we had a really cool thing, actually loneliness. As we were doing some of our focus groups in design, we ended up calling AI learning the wearer's lifestyle. Of course, what we're doing is AI. Okay, you got it. But the first time I said AI, or actually had the focus group person say AI in a focus group, the overwhelming response was, I do not have patterns. And it was very, kind of hard, you're calling me boring. And it's like, everybody has patterns, right? I bet my patterns are more boring than yours. But that's not the way they looked at it. They look at it as, I'm not interesting. And so we also did the loneliness question of, when 2 Kanega watches are often near each other, we know that. And we could say, hey, Jeannie Ann, you haven't, said hi to Keren in a while. And, today'd be a good day to give her a holler. What do you think? And everybody loved it as long as Keren had to call me. Okay. But if my watch said, Jean Ann, you should call Keren, they hated it. Okay. So it was the implied responsibility of who has to take action. And then we played the same game with the adult children and then the grandchildren. Right. And so when it was the adult children, they really didn't like it. But when it was the grandchildren, some liked it a little bit, but the rest of them were like, well, my grandchildren should just remember me by themselves. It's like, okay, well, that's the world you're living in. Go for it.
That is wonderful.
Keren, there's a very interesting question on sales channels that Matt, I think, is asking the question. Matt Cooley, is that right? Should we go into?
I was just about to start taking audience questions because we only have about 9 minutes left. Hi, Matt. And Matt is asking, what are the most successful sales channels for each of your companies? That is a wonderful question. Thank you, Matt.
So I can jump in and I can talk about the surprises, I think, that we have both B2B and B2B and B2C channels. Mostly we're B2C. So the surprise is that we do have holders that go through Facebook and Google Ads and will directly sign up via our website. That is a shock. We did not expect that. But alas, it does work. It definitely works with adult children because that's a channel that they're more familiar with. Again, the surprise on the B2C is that in reverence of face-to-face events, because in reverence to face-to-face events is also where we get more referrals as well. And that's, again, I wish we would have spent our entire first year's marketing budget only on face-to-face events to have started. With regards to B2C, there are a lot of different companies that are willing to work with us. It could be employers. It could be in-home care groups. It could be assisted living groups. It could be elder care or senior living facilities or senior communities in general. So they all have game. And I would say of all of them, the ones that we enjoy the most are still on the B2C side or the face-to-face events.
I'll jump in. For us, it's been B2C, which has been the fastest way to get the product out in the market. And I feel like we quickly solve the most acute problem, which is adult children wanting to make sure that mom is okay. Typically, we don't find that the older adults are the ones shopping for the technology, especially our demographic, which struggles with technology. They're not going to be out there looking for more technology. When we have had success in senior living, it's usually because it's a very visionary, innovative organization, and they want to be ahead of the curve. I find, like, if you look at the crossing the chasm graph, some of these industries tend to be in the laggard category, and they're watching what the leaders are doing, and they will not take risk on their own. So I would strongly recommend that you build up a lot of conviction and momentum with a customer base that you can get to. And right now, I do think we can get to it if you're solving a real problem for someone. And once you have a few hundred customers there and you have a good story, then you could springboard over to B2B and use those wins as evidence that you are somebody that they should be doing business with. But even in that case, you still get so much status quo. Nothing's broken. We're just going to keep doing what we're doing. People are going to fall, Yeah. I even heard somebody say one time, they're like, people are always trying to sell me fall prediction analytics. They're like, I don't need fall prediction because I know they're all going to fall. So it's kind of wild trying to crack into B2B. I'd say find wins with those folks that you're solving the most acute problem for.
Yeah, and I'd say, look, it's a well-worn path to go from private pay consumer health to B2B consumer health. They are all super risk averse unless you've got some other special in sauce, which a semiconductor engineer is not going to have. And so we we simply wait for the B2Bs to come to us. Things like 3 years of Wirecutter is a statistic that they look at, and then they do talk to us. Having said that, they still, yeah, there's a reason I don't do corporate. But we're direct to consumer, and we are on the web. So it's Google, Facebook, Bing, affiliates and refers. With the changes that Google made with the affiliate channel is not doing as well anymore. And of course, with the changes in AI generated summaries, Google and Bing pay-per-click type work for direct-to-consumer companies is also less important than it used to be. So, even with what we do, and by the way, 67% of our wearers bought for themselves. We actually advertise in channels that, well, the company's 12 years old. So 12 years ago, I would have said there's not a chance that we would ever be on Instagram or ever be on TikTok. And guess what? We are. So, it changes. And I think that's the fundamental. We actually started out B2B2C. We were going to go through the traditional medical alert providers. And what I discovered is they only know how to sell commodity. So they're all really good at selling the same garage door opener for the same price. And that's not what we built. And so we had to learn from the ground up, direct to consumer, which was interesting.
But ironically, investors really don't like it. And they always try to get you to do B2B. So be careful who you listen to. Like, consumer will get you traction very quickly, but investors will keep steering you away from it. And it's like your head will be spinning.
Keren, I saw a question about targeting adult children, and I wanted to address that because that's a huge part of our buying process, and it's a huge part of who we're targeting as well. And I find that can be a difficult population to find because the adult children are often not living in the same community as the older themselves. So what we found is understanding who's an adult child. Likely they're about my age, right? They're somewhere between 45, 65 in that group. So often they have specific characteristics. They're sandwich generation, they're perimenopausal or menopausal. And so we find that making partnerships in those types of groups is helpful. For example, we're speaking at the Women in Medicine Summit together with Lean In, the Lean In founders on Friday, and we're addressing women who are sandwich generation physicians at the peak of their career. And we're talking about, are you prepared for caregiving? Because caregiving might derail your career. You might have just become chief of surgery or chief of your practice, or you're growing your independent practice. Are you ready for this? So it's really taking that kind of question of how might you be derailed? Also partnerships with social workers and partnerships with discharge centers, for example, discharge nurses, because very often when do you need a service like ours where you have concierge service, you have in-home services, in-home support? It could be because your older is super motivated and wants to plan in advance, or it could be that we're coming in because there's a crisis. And if it's a crisis, you're talking directly to the adult daughter. And so if we're there together with SNFs, if we're understanding the SNF population, who's managing the discharges at SNFs, who's managing ER doctors or orthopedic physicians and discharges from hospitals, that's actually a perfect place for us to be, to have those relationships with adult daughters who would then be picking us up. So again, I think if that is your target, whoever asked that question, if that's your target, those are really good places to look for that demographic who is trying to solve the problem of preparing for older care support.
And does anyone have anything else to add to this?
This was fun.
Okay. This was fun. And we got about 1 minute left. I don't think we have any more time for answering questions. So I want to wrap up today's webinar. I want to thank my wonderful, wonderful panelists, Jennifer, Costin, and Jean Ann. Thank you so much for joining me today. I want to thank the audience for joining in live. And we will have the recording available hopefully by the end of this week. And thank you all for joining. It was a pleasure to have you. I'm Keren Etkin. I run TheGerontechnologist.com. And if you want more of this content, you should sign up for updates. We do have a free newsletter. Have a great rest of the week.
If you enjoyed this video, you will definitely want to check out my video about the #1 mistake AgeTech startup founders make. I'll put the link right here. Until next time, stay humble, stay curious.